and part of the hub team.
Paulette?
Paulette Carter. I am the program manager for mental health consultation for the Bureau of Family Health and a social worker by trade.
Margaret?
Margaret Smith. I'm a social worker in Lafayette, Louisiana. I work for LSU's Family Medicine residency program here in Lafayette.
Welcome, Sienna.
Good morning. Sienna Nakos Caldwell. I'm the LCSW and I am the resource specialist for the provider to provider consultation line.
Dr. Queen?
Hi, I'm Dr. Queen. I'm a pediatrician, graduated from LSU, and I work at Our Lady of the Angels in Bogalusa, Louisiana.
Jen Bordelon?
I'm Jen. I am the social worker and therapist providing therapy at the Lafayette Community Healthcare.
Welcome. And is it Elise Gauthier?
Yes, Elise Gauthier. I'm an intern with LSU. I'm interning right now with PPCO and for MSW.
Awesome. Welcome. And Dr. Chandler?
Hey, good morning, everybody. Happy to be here. Jonathan Chandler, working as a medical psychologist with Access Health Louisiana, and I have a small private practice as well as doing some of these trainings. So thanks for having me.
Awesome. Okay, welcome everybody. We'll jump right into.
I appreciate everybody's recommendations and input. And normally at this point, what I would do is we would type this up and send this to the case presenter so that you have follow-up. So in the future, if you ever present cases, we would send you a summary of the recommendations from the team. Thanks everyone for your input. We're going to go ahead and move forward with the presentation. Dr. Chandler is going to present. I will be advancing the slides, so you'll just have to give me some sort of indication when you're ready for me to move forward. So you can begin whenever you are ready, Dr. Chandler.
Okay. Well, thanks again for having me. It sounds like I have some really awesome providers here today. So thanks for attending. I condensed this down from 3 days to 3 hours and now 20 minutes. So bear with me that this is very, very concise and like a rapid fire session. But I just want to give you kind of broad strokes. So consider that this is just a general overview. Obviously, I'm not going to, convert everybody in this one short session, but I hope to kind of put something in your ear about becoming an advocate, because that's really what I believe in, is that it's no longer okay to just be accepting and understanding. I think we actually have to move a step forward and actually become advocates for our patients. So regardless of what our background or belief systems are, we are here for our patients, and that's what we do. So I've come up with what I think is a pretty nifty system that you can utilize in your everyday practice, and you can even use it for your notes to make sure that you're hitting on a lot of the areas that are sensitive, especially to LGBTQ plus people. You can go ahead and advance, Jody. So I use LGBTQ plus. If you want to use some version of that without having a whole alphabet soup in your mouth, that's fine. Use something that's considerate and understanding, and that you are being as inclusive as possible, because I think that's our main goal. You can go advance. So in healthcare, you can keep clicking until it's all there. So healthcare. Are we friend or foe? And unfortunately, the answer still currently is kind of both. It's sort of a double-edged sword that transgender folks have to come to us to actually get a label of gender dysphoria in order to advance in treatment and get hormones and therapies and different interventions. However, we have the opportunity then to be a source of a really great support and connect them with other great supports. And we can normalize their experience when they've had so many other unfortunate negative experiences by the time they've gotten to you. So our hope is that when you interact with somebody on the spectrum of gender, that you are the positive experience, not the negative one. So that's why these trainings are important, because without them, I believe that you can unfortunately and unintentionally contribute to some of the stigmas and inappropriate behaviors and contribute to their dysphoria, and sometimes kind of scare them out of treatment and delay their progress. So I think this is a great opportunity. I like to reframe it that way, that we have the opportunity to advance their future. And I think that's a very big power that we have that we need to utilize. Next. So this is the unfortunate reality for transgender folks in mental and physical health, is that there's a much larger suicidal potential, suicidal attempts, psychological distress, and serious psychological distress, which meaning that they've had it in the last 30 days from the time that they see you. So there's a huge disparity here that really shouldn't exist. Next. So they went, so we went like, where do we start with all of this? We went to the medical students and we asked them these, very kind of blatant questions about, how they feel about their explicit bias. And some were actually very forthcoming and said, yeah, I absolutely do disagree with LGBT folks, and I don't agree with it, and I'm not going to treat somebody. And they were very forthcoming about that. Which is both surprising and disheartening, unfortunately. But this was a few years ago. This was 2015. They haven't redone it, but what they did do is, next slide, they went back and said, okay, what could we do about this? And they just did this random sample of 50 medical schools, and I'm not going to read through all that, but basically next slide, they said, if we gave people just this simple, not simple, maybe 10-hour didactic program about teaching people about LGBT folks, how far could we get from that horrible number to a better number? And they actually saw that it really did work. That 10-hour course, even those people who were blatantly saying, no, I will not treat somebody, actually kind of changed their minds a little bit. Not all of them. Of course, we're always going to have people who don't support LGBT folks, but it was kind of, I think, a great sign that just with a little bit of training that we could move this forward. So that's why these exist. Next. Just more of the same kind of thinking about pre-course of how your cultural sensitivity knowledge, your gender affirming hormone therapy. And so as you can see, after they had the course, that they then were much more likely to treat people, much more likely to understand the terminology, much more likely to understand the health risks that are specific to LGBT folks. So the treatment worked, their treatment worked basically. And now they can treat LGBT folks a bit better, which is great. Next. So we talked a little bit about, I'm kind of preaching to the choir here, but we obviously have more suicidal thoughts, more mood disorders and anxiety, eating disorders, alcohol, tobacco, substance abuse issues are much more likely in the LGBT, I'm sorry, this is LGB community. Next. And of course, this is LGBTQ, sorry, I'm going to get mixed up here, without the T, that they did these surveys. So I'm not going to read through all of them, but basically it's saying that there are still providers out there who are absolutely not treating people with respect and dignity and treating them as a patient. And there's people outright denying care to LGBTQ people. Next. So add the T and those numbers jump more than double, triple, quadruple, in a lot of cases where they've absolutely refused to see someone who is transgender. They've been refused healthcare, been refused confirmation surgeries, transition hormones. They've been dead named. They've been misgendered. They've honestly been abused by providers, and that just should never happen. Regardless of what your background is, we should never be in the position of abusing patients at all, ever. So that's kind of my thought. Next. So here's my rainbow. And yes, it had to be rainbow. Because why not? It's a good way to remember this acronym of race, age, inherent and acquired disabilities, disorders, diseases, our nationality, where we come from, our legal status, our belief systems, our orientation, which is a little bit, I'll show you more of that in the next one, and our work, wages, employment, education, income. So basically, this is how I do my notes, especially when I first see somebody. This is kind of my intake model. I'll put rainbow on the, on the side of my paper, or whatever note I'm doing, and I will then proceed to collect that information from the patient. Paying specific attention to things that are specific to LGBTQ plus people that they might not necessarily feel comfortable the first session. So I'm going to ask them things like, have you ever found yourself on the gender spectrum? Do you use, which pronouns do you use? Which name do you use? Things like that. And even if they are presenting as straight cis person, even if they're presenting that way, they may have never been asked these questions and never had or thought they had the opportunity to tell those specific issues. So I always leave that open, even if I don't have any suspicion that they may be LGBTQ plus, I'm going to give them that opportunity. So this is with everyone. This is not just if somebody is identified as LGBTQ. Next slide. So I take it from an integrational model, intersectional model. Obviously, these things all make up one person. So our rainbow, we all have one. You have one, I have one, our patients have one, and they're going to kind of dance in the room with us. And when we see a patient, they're bringing all of these things with them. And you as the provider are bringing all these things with you. So they're going to interact with each other, whether we like it or not. So you have to be aware of your rainbow in order to understand and collect somebody else's rainbow and be able to integrate in the room together without offending and marginalizing anybody. Next. I don't have time to get into that stuff, but it is in my book. I'm writing a book, by the way. So for each section of the rainbow, you're going to look at privilege or powers versus differences and stigmas. So a major example is white versus a person of color, or male versus non-males, heterosexual versus LGBTQ plus people. And to recognize that even LGBTQ plus people most likely have at least one privilege that they have had throughout life that is part of their rainbow. And you do too. Especially, I mean, just one right off the bat, we're providers. We're in a place of hierarchy. We're in a place of height, one step above them, whether we like it or not. That's how we present. So when they come into the room, they already know you're in the place of authority. So we have to be careful with that relationship. We have to be specific and intentional in our thinking. Can anybody think of another example of a privilege or a difference based on the rainbow model? I know I kind of just ran through that really quick. Tell me if I'm going too fast.
Yes, like health status.
Absolutely. Yeah. Disabled versus able-bodied. We saw that a lot with COVID. We're still seeing it with COVID. I have several patients who have long COVID. So now that's something we have to add to their rainbow because it is affecting their daily life now. So that is going to be part of a stigma. Is like some people are still testing positive, so they're not allowed in certain environments. And they understand this and they wouldn't want to go in the environment anyway, but it's still a stigma. So it's like, oh, you have this sign on your head, you know. Okay, next. So again, here it is again. I pay particular close attention to our belief systems. So even with the person who is presenting LGBTQ plus, they may still have some unresolved issues. And this is mainly talking to the therapist. They may have some unresolved issues around religion or spirituality, political ideology, especially in Louisiana. We come from a red/purple state. We have some Democratic leaders, however, mostly we're red, especially when you get out into the other parishes outside of Orleans. I'm kind of in this microcosm bubble in Orleans, and it's pretty liberal. Outside of that, I recognize, and I have many patients who are all over the state. So I have to recognize that they are still living in an environment that is very, very strict or religiously conservative or politically conservative. And so I have to be careful to navigate that, especially when a patient is coming in and they are still under their parents' care. I have to be sensitive to not only the kids' rainbow, but the parents' rainbow as well. Next. How much time do I have, Jody?
10 minutes.
Okay. Do
9
y'all want to do your rainbow? Do we have time to do your rainbow? Real quick. And we don't have to share it. I just want you to kind of go through the exercise. So this is usually when I would do that. It's like, let's go through the exercise. And I think the next slide will show you the categories again in case you, oh, that's my model. Go next. 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 And you'll get these slides too if y'all want to. That's just an example. Next. Next. Sorry, I thought it was next. Maybe go back. I'm sorry. Go back to where is the whole rainbow, where we can get an idea of how to write down your own rainbow. Okay, there it is. All right.
Oh, this one, sorry.
Yeah, that one. Yeah. So your race, your ethnicity, your cultural background, your skin color. And right now we're just kind of jotting this down. But after this, when you have some time, sit down and I want you to actually think about how those things, each category, how those things have affected you in your life. How has your race affected you pretty much every day throughout your life? How does it still affect you? How does it affect you with your friends, your family, patients? I want you to kind of really do some thinking around that topic, and then go to the next one. And this doesn't have to be all in one day because it can be pretty intense. If you're doing it right, it doesn't feel super comfortable. So the next one would be age. So how has your age affected you? And that could have changed throughout your lifetime. I was a very young doctor. I graduated when I was 23. So I was very young. So I got told, you're not old enough to be a doctor. You're not really a doctor. Where's the actual doctor? All of those things. So I got ageist, from the young perspective. I'm not that young anymore, so I don't get it as much. But I do blow people's minds when I tell them that I've been a doctor for almost 20 years. So that could be how, one way that you've gotten that, or the opposite. People say you should retire. I've actually heard colleagues say that to one another. Then there's the inherent and acquired disabilities that you have yourself, things that you've dealt with over your lifetime. Then were you born in this country? Do you have status? Do you have legal status here? What is your birthplace? Are you from Louisiana? That's a big thing around here, especially with patients. Are you from Louisiana? That's almost the first question I get. Are you from New Orleans? Are you from Louisiana? That's a big deal to people. So you have to figure out a way to tell them the truth, except, in a way that doesn't make them feel like you don't understand where they come from. Then there's belief systems, your religion, your spirituality, political ideology, and how those were developed, how those developed over time. And then we get into orientation, which I will have to send you the model because it's not coming up when you do the slide, Jody. So I'll have to send y'all I have a SAGE model that goes through the different sexual orientations, sexual identity. But basically how your sexual identity has impacted your life and those around you. And then education, social, economic status. And again, these things have probably changed over time. So it's again to think that this is a working model. It's not just like this is your rainbow and that's it forever. These things change over time, but it's important to understand how we've gotten to this place so that we can understand it from our patient's perspective as well. So did I do it in time? Is that a good time? Okay. If this thing can scroll, then I can see it, but for some reason, I think when I converted it to this format, it's not scrolling to show you the whole model. But I can send that to folks if they're interested, if you want to give me your email, or I can send it to Jody and she can send it to you. But basically it's a cute little guy who, let's see if I can, well, I'll just email it to you. But, and with some instructions. Does anybody have any questions? And I feel like I just talked at you for like 15 minutes straight.
I have a quick question.
Yeah.
When you mentioned that doctors wouldn't treat, do you mean like treat at all as a patient or treat specific
Sure.
LGBTQ
Yeah.
issues?
Yeah, so what you'll get is, and there's an unfortunate sophistication around that at times. It's like they will say, oh, that's just not something that I'm specializing in. So I need to refer them to somebody else. That to me is a denial of, and it may not seem like that. And of course, we shouldn't work outside of our scope, but why hasn't that doctor gotten that education? Why hasn't that doctor gotten the information? It's quick, right, Lisa? I mean, it's not that difficult to get that specialization. Although, I mean, it is important, and it is, you do need to get that education. But the fact that that doctor has not done that means they need to work on their rainbow.
I completely agree. I went from knowing absolutely nothing to literally taking and learning on my own how, and working with an endocrinologist on how to do a hormone replacement therapy. And now I see I have about 6, 7 adolescents, and there was no one in our company that really addressed that, except for maybe, I think there was like 2 other providers, and no one that did adolescents initially. And so that, and now it's becoming, okay, we have to do this. And I think that has been a great growth in our office and in our company. And that is important to me, because I never want to see anyone not get treatment, whatever they need. So, and it was all thanks to Dr. Chandler. So
what did it take to kind of get to that point where you did have providers, right, who were, learning and then obviously treating patients? And I mean, what kind of motivated that change, that shift?
I have to say it was, we started with a person who was very involved in the community. Initially was an MD that was or a DO that was very involved in the community in New Orleans. And we started with him, and then adding on Dr. Chandler as part of our and his wide knowledge that he had really opened up our company. And so it was just getting people that were actually extremely knowledgeable in that area that I think really motivated our change. Wouldn't you agree, Dr. Chandler?
Yeah, I mean, I think within the organization, I'm not sure which one you work for, Dr. Carter, but we definitely had a lot of support within our organization, which, I was both heartened, but also kind of surprised, because here I was coming in, they didn't really know anything about me, and I'm like, hey, I want to blow up the program, and they were on board. And I can't say enough about the support that we've gotten and the people that have come forward, and that's what I want to specify, is not just LGBT people who are already in the community themselves, but these are people who are straight, cis, married to, like they have no other reason to do this except that they know it needs to be done. And I think that's where it actually comes from, is like the need. We're seeing the need come in, and we need to meet that need.
So we have about a minute left for questions. Does anyone have one more question that they'd like to ask Dr. Chandler?
All right, don't be scared.
Thank you so much.
I'm gonna
Okay.
forward through the slides. The slides will be sent to
Yeah.
everyone, but I'm gonna
ahead.
just quickly run through the rest so that so no one get dizzy while I do it. But I wanted you to just know how much information will be coming your way. As I get to the last slide, Dr. Chandler, thank you so much for your time and your input and your expertise. It
Thank
may
you
have been
so much for
faster
having me.
from, yeah, we definitely an
So-
area that needs to be expanded in our knowledge base for all providers. The last slide, I'm going to get to has that it'll have the link to the evaluation. If you are attending and need CMEs or CEUs, you need to do this. So thank you. You'll need to do the survey, and I'll send out an email as well within 48 hours. Our next session will be on March 14th, and the presenter will be Dr. Finelli, Juliana Finelli, who will be presenting on screening for depression in caregivers and birthing persons. So if anyone has any questions, we'll stay on the line for a little bit more, but thank you, Dr. Chandler, for your presentation, and thanks everyone for attending, and I hope everyone has a good rest of the week.
Thanks so much for having me.
Thank you.